France's new lockdown rules, which included the closure of outdoor markets, were initially met with some resistance.
It's a psychosis.
Yeah, but there were certainly cases, unfortunately.
Sure, there were cases, but you go to Carrefour and everyone is like this.
Nearly 2 weeks into confinement, the French, resigned, are finally following instructions to stay at home, just like about a third of the world's population, now also under lockdown, which authorities hope will yield results soon. Paris's streets may well be virtually empty, with residents now largely following the strict rules of confinement imposed by authorities here. But despite the collective effort, the French capital and its suburbs have just become the new epicenter of the coronavirus epidemic here in France. Over the past few days, about a third of the new registered cases of COVID-19 were registered here, something doctors say could have a significant impact in the region's hospitals in the weeks to come.
The worst is to become overwhelmed in our intensive care beds and not be able to offer each sick patient the means we will normally be able to provide. For several days, we have a significant increase in the number of people that arrive in the ER, including serious cases. Half of them are admitted. In normal days, in an ER, we tend to keep 15% of our patients. These days, we're admitting 50%, which shows how sick they are. And a small number need to go to intensive care. The vague rises every day. If the number of patients continue to rise, we will face the same situation they faced in the east of the country, where we'll face serious difficulties in our intensive care unit. We will lack people, beds and ventilators.
The stakes have never been higher for public healthcare systems all over the world, struggling to bring the epidemic under control. In France, authorities say we're in this crisis for the long haul. The question now is how long until public hospitals reach breaking point. Annelise Borges in Paris for Euronews.